Welcome to Revenue Protection Strategies for Physician Practices. This program is part of a series of educational practice management briefings sponsored by McKesson. Aimed at physicians and practice managers, this series offers advice on how to position your practice for sustained growth in a changing healthcare market. In this program, we will focus on hospital and physician integration strategies.
Hospitals and physicians are going to have to work together in the future, even more so than they are today, to be certain that a high quality of medical care is provided in a very cost-effective manner. And however they want to approach that, whatever level is comfortable for both organizations, is really that integration. There's a number of factors really impacting the way that payment for health care is moving. I mean, just look at the government regulations that we're looking at now for the possible development of a public plan. All of those are going to impact how the dollars come in. The question is, how do we work together as a team to provide high quality, cost-effective care to the patient? Hospitals, I think, are trying to get that integration brought forward simply as a means of not controlling the physicians, but simply as a means of being able to coordinate the overall care because of the services that they already provide that are involved in that care delivery continuum. The strategies I see hospitals utilizing for physician integration are as varied as integration itself. A number of hospitals have approached this on a true employment strategy. Don't know that it's always successful because I don't know that the hospital is truly considering the impact of true physician employment. Other hospitals are approaching it through subsidiary companies. Some of the largest medical practices affiliated with hospitals are actually subsidiary companies. We also have instances where we've got institutions that are looking at simply partnering through gain sharing and co-management type situations that are allowing the hospital and the physician to team up to try to control the cost of delivery of care within a very specific specialty area. All of those are being utilized, some more successfully than others, but it really gets down to a point, in my estimation, as to where's the comfort level between the hospital and the physician practice. If we can find a point where both parties are comfortable and are willing to move forward at that level, I think you can find and build a successful integration. As part of the integration continuum, if physicians are considering employment, to me the big thing that physicians ought to consider is what are the other options? Because the continuum is a vast possibility out there for them. They may not be comfortable with straight employment, simply because of the fact that, they may, in some cases, I've had physicians tell me point blank, they feel it's factory medicine, they've got to produce to quotas and that sort of thing, and they don't enjoy that. They spend too much time furthering programs and processes for the hospital and not caring for the patient. There's the entire psychological difference between a hospital and a physician because of the way they were socialized, what they're trained to do, and all of that sort of thing. So employment itself may not be the best possible choice. What I urge physicians to do is, if they are considering affiliating much more closely with a hospital, is do their due diligence as to the integration models that are available to them, whether it's stipends, whether it's co-management agreements, whether it's other types of joint ventures, whether it's a subsidiary physician corporation, whether it's professional services agreement, or whether it's true employment. Do your due diligence. Review each of the models. Look at the pros and cons of each model from not only the perspective of the physician practice, but the perspective of the hospital, and see where a comfort level can be developed that both the hospital and the physician can accept and know that at this point is where we're going to start. The key points I see hospitals and physicians needing to consider to get to an ultimate win-win situation is that physicians and hospitals for the most part, look upon these interactions as truly business. And as I see it, the issue is you're dealing with people. And because of that, you also have to consider that this is the building of a relationship. And that relationship you want to go on from not only today, but into the future. And you want it to be done successfully. So spending a little bit of time talking about the strategic direction that the hospital would like to move forward, as well as the physician practice, some of the care initiatives and the care imperatives that physicians feel for their particular patient population. Does the hospital agree with that? All of those things, in my estimation, move you to a point to be able to say, okay, as a group, we agree that this is the appropriate direction for the care of the patients within our particular service area. If you can agree to that, and you can agree to the ground rules in general of how you feel you will work together as people, then you can move forward and develop a business model that actually mirrors that. So it's considering the human nature of the relationship that I think a number of organizations forget as part of that particular process. We can't divorce ourselves from the fact that we're humans. And when we ignore that is when I think we get to a situation where we are not creating a long-term successful relationship.
This has been Revenue Protection Strategies from McKesson. Our consultants are available to answer your questions by phone or email. For more information on healthcare topics relevant to physician practices, visit our website,